Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
And
therapist.
together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Brad, what did you want to talk about today?
Bob, I want to talk about the top 3 best stretches for hip mobility. And this is a request. This is for Tony.
All right.
Tony, these are exercises.
Hi, Tony.
Specifically for you, as well as anybody else out there who feels like their hip is a little tight.
Right.
Okay. And we'll go and it'll make a lot of sense if you're having
a lot of times tightness will lead to pain.
Exactly.
So if you're having pain, this might be something you want to try.
Right. If you have a hard time putting your socks on, your shoes on in this typical position, this is for you.
Yeah, if you go like this and your legs like this, and you can't go like that.
Yeah.
You can actually compare the two sides, by the way, and you can see if one's tighter than the other.
Right. So how are we going to fix that?
Well,
if you do one and your knee's up here and the other one, your knee goes way down here.
Right.
Let's go. Why don't you stand up, Bob? We're going to start out laying in. You can do this in bed or laying on the floor. Probably better on a carpeted floor, but you can do it in bed. Knees in this position. I call it hook line. Right ankle, if you're going to do your right hip, goes on your left knee, just like that. I call it the figure 4 position. I'll get so you can see it.
Yeah,
and then
looks like a 4.
Then you're just going to gently put pressure on your hip like this. This should not create any sharp pain. If it does, do not do it. And
we generally recommend, Brad, pressure on, pressure off. And we have you say the words because it actually tells you how long to do it then.
Good point, Bob.
Pressure on, pressure off.
And while you do this, relax and breathe. If you're holding your breath and getting all red in the face, it's not going to be as effective. I really like this one. It feels good.
How many reps, Brad?
I like to do 5 to 10. In the morning, it depends how big a hurry you're in, but I think 10 is a good number to go for.
That's usually what I do is 10.
Mm-hmm.
You can do this one too, Brad, if you want to get a little more aggressive, is put this one down. Put this one down and go like this and go like this.
Sure.
And a little harder for you to do.
So I don't know if they can see it. Yep, so with the leg down, and then, good point, Bob. And then the next one you can do, you have to be on a bed for this one, or a table. Probably your bed at home.
Don't fall off.
Yep, you're just going to slide your hips over to the side, but not your shoulders. Going to be a little bit of an angle, and then you're going to lift this leg, and now you're going to stretch those hip flexors, commonly tight, especially for a job where you sit all day long. You can do this and get a little more aggressive, and then bring this knee up.
Notice this. Notice this when the leg is down. Now watch the hip when he brings it up, how this comes up. So you see he's a little bit tight, isn't he?
Yeah.
So, yep.
And it feels good. I feel that stretch right there. And we're going to hold this. I like to hold it for 15 to 30 seconds. This one, it's harder to do the pressure on, pressure off routine. Okay. And then seated. And this makes a lot of sense to what we were referring to before, Bob, as far as getting your shoes and socks on. You're just going to do this, and again, pressure on, pressure off, pressure on. And you can see by the first one, and then you go compare that to the 8th or 9th one, you're going to find out it's probably going to be lower and stretch more. And then, of course, do both legs.
And give yourself some time. I mean, this may take a couple of weeks before you see any gains.
Right.
I mean, it took a long time to get tight, so it's going to take a long time to loosen up, too.
Yep, exactly. Okay. The next one, take a pillow, or if you got carpeting, that's okay. But you need something with some cushion for your knees. And you put your leg down like this. You get in this position, posture back like this as opposed to like this. And I put my hand right here, and I'm going to put pressure forward going this direction.
And look how good a posture he's in. He's really got good posture.
I've been practicing, Bob.
Yeah, you look very, bravo.
So same, pressure on, pressure off. And you should feel a stretch here. Again, all of these should just feel like stretches. A little stretch pain is okay. Sharp pain, you're going too hard and you need to back off a little bit. And again, both legs.
Balance yourself out.
There you go. If you only do one leg, you might find yourself walking in circles. That's a joke. Come on.
He loves that joke.
Lighten up.
I think I've heard that one 100 times.
Wow. So, okay. So, Tony, I hope these work out well for you. And just remember.
Yeah, let us know, Tony.
Right. Just remember, if you look at Leopold Bonaparte, or what's his name again?
Napoleon Bonaparte.
Yeah, we can fix everything except for this broken heart. But we're working on it.
Yeah, we're doing what we can.
Fold that thing up a little bit like that.
I don't think he's there yet.
There. That's going to work. Here.
All right.
Put that in there.
Now we know it didn't work. Thanks.